getting their vaccination clinics underway. And across Manitoulin, I think there's one every day this week for vaccinations. So I mean, things are starting to move, and we realize that here at GHL, and so we wanted to run this webinar to give people an opportunity to share ideas, and also give you guys a little bit of a recommendations from our best practices of what we can do with the EMR to be able to help accommodate our workflows right now in this time. So Brian's got the agenda up right now, and a little bit of a brief overview of what we're going to talk about today. And by no means are we bound by this agenda. This is just a loose conversation piece. What we want to cover is running searches to select and export
Yes,
client
so those are
lists.
the two pieces. One has to connect into,
Hey there, Nicole.
and then that one goes to the back.
Just going to mute you there. Okay. So we're going to run through searches. One of the things that clinics are having to do is define certain cohorts of age demographics for their vaccine rollout. So we'll cover how to do that. Using the calendar and appointment types to manage vaccine clinic appointments. This can be a valuable tool to track who's showing up and recording, information. It goes beyond necessarily COVID vaccination clinics. So keep in mind that we can use this information outside of just COVID. COVID toolbar and widgets for tracking vaccine statuses and consents. This is using the dashboard feature that some of you might be familiar with. We're going to go briefly over the consent forms and the documentation that's required from the government with regards to administering these vaccinations. And then some PS Suites reminders of how to set up just ways that a provider is able to keep track of who has received the COVID vaccine, who hasn't, and when it's appropriate to have the next one booked. So without further ado, Brian, if you don't mind, I'm going to share my screen. And feel free to stop me at any point, guys, with regards to if you have any questions or if you want me to slow down or show you something over again. If there's some different ways that you think that this can be applied in other avenues of the way you use the EMR, by all means, stop me and fire some questions away. I want this to be a two-way communication with everybody. All righty. So we're using our sandbox EMR here, so we're not going to be disclosing any actual patient information or demographics. So bear with me if any of the search results or any of the information is very limited, because we don't necessarily have any real data to use. We just have some preloaded fake patient data. But one of the first things that came to our attention was the need to define a demographic cohort for vaccinations. And there's a number of different ways you can look at your patient list in the EMR and extract a list of patients based on whatever you're looking for, based on the criteria. The very first way, or the most basic way to get an idea of who is part of your patient list in the EMR is simply by clicking on this reports button at the top of the EMR and going to list, and there's an option here for patients list. Now, if you click this, what's going to happen is it's going to pull up a list of all of your patients in the EMR that are active, inactive, and give you an idea of who's in there. And you can organize this by a column such as age. You can isolate it by gender or even alphabetically if you want. But from here, what you're able to do with this information is you can click on the reports tab at the top right, or top left, sorry, go to utilities. And if you save that as a tab delimited, you're able to bring that into Excel and create a spreadsheet so you can isolate any groups of information that you want. So for example, if you're only looking for people 60 and up in Excel, you're able to isolate that information. So that's one way to extract information in terms of your patient list for vaccination cohorts. Another way is by using the search function in the EMR. And to run a search or to even define a search, you need to have a set of accessibility in the EMR, and that's allowing you to see all features of the EMR. So things like, roles like nurses, administrators, doctors, even mental health to a degree can potentially run a search or edit a search. It depends on your settings in the EMR. The view privileges have to be set to all to be able to edit these searches. So to create or edit a search, you're opening up the records window of the, it could be, you could have a patient open or you can have a blank like I've got here, but you're going up to settings at the top here and edit searches. Now this is going to give me a list of searches that I already have preloaded, but it gives me the opportunity to add a search as well. So we've got a number of different searches here, but if we want to define a certain demographic of people, we can create a brand new search here and call it patients 55 plus. So we're looking for anybody in the EMR that's over 55. And to do that, we just simply add a line here. And we're going to go to demographics at the top. And notice this is a giant list of different ways that we can really define our search criteria, starting with demographics. And it gives me the opportunity to search age. So when I click on age, it gives me a series of symbols here that allows me to look at a very specific age. If I'm looking for, I only want 55-year-olds, I can put equals 55. If I'm looking for over 55, I can put the greater than sign. There's a less than sign, but there's also a greater than or equal to. So we'll do that for our 55 cohort. So now we're looking for anybody that is age 55 or over. Who's got the mic on there, right? Mind muting? Thank you. So now that we got a criteria in here, all we're really doing is clicking our perform search button at the bottom. And if you just notice down here where it says columns, it says patient, first name, surname, age, etc. We can add to this list of columns depending on what kind of information we want to pull when we run the search for people that are over 55. And I'll show you what it is just as a bare bones search result. So if I click search down here, all of those columns that I showed you before, patient, first name, surname, age, phone number, etc., that's what breaks these columns down. So we have the opportunity to add to these columns if we're looking for more information. So when I run the search, again, we're really limited to the number of patients we have in our sandbox play area here. So it's really only pulling up these 2 patients because that's really all we have in our demo EMR here, is grandma and grandpa PSS. And if I wanted to add new information to those searches, I'd go back to my edit searches and patients 55, and I can define any criteria I want. So say we want a range of patient ages. So for example, the cohorts may be 18 to 30. I'm not quite familiar with what the actual age cohorts are right now, but if we say we want this list to generate a list of people that are over 18 or equal to 18, and we'll add a line, add equal to or under, we'll say 29. So that's giving us a range of ages that we're looking for to be able to generate a list of patients from. So we're going to go to perform search. And again, keep in mind, we have the opportunity to add a column here that's going to appear in our search and put in whatever information we want it to show. And the benefit of doing that is because then we have the opportunity to take that search result and all of those separate columns and bring that to a spreadsheet in Excel, so then we can play with the data a little bit easier. So I'm going to do something arbitrary, like say, I want to know the patient's, I don't know here, health card number, sure. So then it adds a column for health number. So if I run that search, hey, sorry, what's that, Elaine?
Well, I have a question about that. You're searching for something specific to the client, but can you also mark it, because I want to know how many 55 and over are in a certain reserve. Can you do
Oh,
that?
perfect. Yeah. That's great. So what we can do here. Oh, I just accidentally pressed search here. That's, yeah, great. That's a real life example. So I'll go to edit searches here again. And on our patients 55 plus, we've got our age range, for example. So we know, this is the age of people that we're looking for, but we also want to add the parameter of community. So then we would add another line, and this depends on how you're tracking, or rather where you're tracking the information of where your community members are. So I would imagine in your demographics window there, Elaine, there's probably something in there that specifies where the patient is from, whether it's a primary location feature. This is looking, again, this is the demographics here is referencing, let me just get this out of the way. This page here, the patient's demographic window. So all of those options are in reference to whatever is appearing in here. So if you're tracking that information under patient MD, for example, which I believe Namadzwin may be doing, if you click on that option, there's a drop down for AOK and Whitefish River, etc. Then you know that you should be looking at the patient MD when you add a line here. And patient, what is it called? Provider, where's the provider?
Is it primary provider name right there, Jesse?
Primary provider name.
That's
That's
it.
going to look in here though, Ev. That's not looking
Oh,
at
right,
the MD.
right. Sorry, my bad.
If you're tracking it in the, where is it? The city.
Yeah, that's it.
Potentially, we're looking for a specific city name, contains WRFN or AOK or Shishiguaning in their city address. We can indicate that. And then that way the criteria is setting, we're looking for people between 18, 29 who also have an address labeled in Shishiguaning. So it really depends on how your clinic is recording that information of separating the different communities that you're servicing. That will define what exactly you're putting in the city address, or it might not even be city address. It might be something else. It might be, maybe you're putting that information in something like primary location. And in this case, it's default. But I know for things like North Bay, for example, the North Bay Indigenous Community Hub, primary location is the actual divider of communities. So then they would just indicate, maybe this is Bear Island, or this is Nipissing, or this is Dokis. And that's a different way that you can divide your patient lists. Does that make sense, Elaine?
Thank you, Jesse.
Okay, good. But I don't believe we have any Shishiguaning residents in our fake information or in any of our fake patients, so I'll get rid of that line. But that's, again, you can add as many lines of criteria as you want when you're doing these searches based on whatever you need to find here. And so notice there's, when I'm putting in age 25, 29, age 18, there's a button that appears here. Even if I add a new line of criteria, I'll just do something arbitrary. Country is Canada. There's always this and that appears to separate these pieces of information. If you look down here where my mouse is, there's an option that says and/or. And what that does is it really changes the criteria parameters to say, I'm looking for somebody that is under the age of 29 and their country is in Canada, or they're over 18. And we can really play with the order of these operations. And the idea is you can kind of separate or isolate different pieces of information that you're looking for in a search. So this is saying country in Canada, we'll say country is USA. So we're looking for people between this age range, and they're either from Canada or the United States. For example, like we can separate different ways that we lump information together. So that may take a little bit of getting used to, but I just want to put on your radar that maybe the search results that you're looking for aren't necessarily what you've defined, and it could be as simple as that and or being the primary reason of why you're getting too much information or you're not getting enough patient information. So I'm going to get rid of this and this, perform our search. Oops. And again, when we're creating that search with the columns here, you have the opportunity to add a column. And if you want to include the community in the Excel spreadsheet, you can click on demographics here, look for the patient's city address, and then add that as a column so that when we run our search, it's going to include that in the information here. But PSS Cousin and PSS Jesse don't have a city address in their demographics window. Otherwise, it would appear there.
Yeah, so back to Elaine's example, I think that adding it as a column would probably suit your needs best, Elaine, because then you'll get a print or you'll get a spreadsheet at the end, basically with all your patients that you're looking for, and you can filter them out by different communities. So you could have one report that had all the communities in it and then just use a filter function in Excel.
And searches can go way beyond like the demographics information. So what I've created here are a few searches. For example, when we're doing our vaccine clinics, once we understand the way that we're recording that information in the EMR, we can start to develop searches that kind of accommodate the way the data is being inputted. So for example, one of my searches that I created is looking for any patient in the immunization section of the CPP. If any of that information contains the word COVID and also a note saying dose 1 of 2, I can then kind of assume that this patient has at least received 1 dose of the Pfizer vaccine or the Moderna vaccine. So if I test that search out, it's going to pull up a list of patients in my EMR. Again, these are all fake patients that have that COVID vaccine inputted into their CPP section here. And so it gives you a little bit of information on whether it was Moderna, Pfizer, and then the date of when that was inputted. So it becomes really helpful, especially when we're trying to do the follow-up once our first doses are administered. If we're recording this, live data, then we can tell a tale of who's next to get their vaccination and keep track of this information. And again, for dose 2 of 2, I've got a very similar search setup. If you click on that one, it's pretty much the same thing, looking for immunizations that contain COVID, but also their comments in the COVID section when the person was inputting it says dose 2 of 2 instead of 1 of 2. So this narrows down our search to show just Stephen is the only patient that was receiving the 2nd dose of COVID, for example. Now, the language that you put in here, what your search criteria is, heavily is dictated on how data is being input. So it's really important to strategize before you're putting information into the EMR, how that information is going to go in, and then how that kind of dictates how it gets taken out. So for example, when we're doing the clinic, actually, I'll put up an actual, this is an example that happened in Namadswin yesterday. So the workflow of how they were doing their vaccine clinic in Namadswin and AOK yesterday, patients were coming in and they really had a really efficient system of sending them around, getting the written consents figured out, the attestation forms, And it was almost like an assembly line from checkpoint to checkpoint to checkpoint to administering the vaccine. And one of the final tables was the input of the data into the EMR. So they had actual data entry staff within the clinic putting information in real time as the patient sat and received or waited for their 15 to 30 minutes to go by. And so what the providers were doing is they would pull up the record, look for the patient that is on the consent form. So they would say PSS, baby. Obviously, they're not going to be giving the dose to baby, but that's one of the ones that they do have a COVID. Anyways, that doesn't matter. So they pull up the chart of the patient receiving the vaccine. They would go into the immunization section here, or on your computer, press Control J, which is to administer some sort of new treatment. And so in the treatment section here, they just search up their COVID vaccine, press Tab, and then they could choose whether it's Moderna or Pfizer, and they would choose that. And then under dose, they'd fill out this information, right? 0.3 milliliters. Site, left arm, whatever information they needed. But the real helpful point that was driven across the intake team was that when they were putting in the first dose of COVID, every single time they had recorded it in the EMR, under the comment section, they were writing first dose or dose 1 of 2. Whatever you choose, it's as long as it's a standard language for every single person that you're putting it in. That way, someone such as myself who's going in afterwards and trying to isolate the information in those searches that we just showed you, this is really what we're looking for. When I define my search under the comment section, I'm looking for this exact language, dose 1 of 2. That's what my search is defining. I'm looking for people's charts that's physically have this text in there. So if I'm putting in there dose 1-ish of 2-ish, that's not going to pull any results for me because it's got to be a very standard language that's being put in here. So just keep that in mind, that whatever you're putting in this comment section needs to be standard across the board if we want to be able to accurately track these metrics.
I have a question again, Jesse.
What's that, Elaine?
During the COVID clinics, and first of all, I have not been attending. I'm working from home this week. Yep. So they're putting all the information in that form as you stated. Mm-hmm. However, I believe the family doctor needs to be aware, and that's another system. Mm-hmm. We asked them, who's your family doctor? Some people say it's this guy or it's that guy. Some people say, nobody, I see nobody. And so when we're going to have to pass this on to, I guess, the family health team in Little Current or Gore Bay or wherever. So how do we pull that information out? Or is that done? Was that done at the very time they were there?
So there's a number of different ways that we can go about that. And so there's a limited capacity for communication from one EMR to the other right now. So one of the recommendations I would make is when we're filling out this information to, potentially consider faxing that information directly to the primary care provider. So like you said, the doctor. So once that vaccine's been inputted, for example, it's going to leave a note in the chart. So notice it says immunized, syringe 1, first dose administered. If I click on this and, initiate a fax and go through the faxing process, now we don't have it set up on our UAT yet, but that's the recommendation, is you can send that note with the patient's it'll capture the name and any demographic information you want included and send that directly to the provider. That's an option that you can do just to put it on their radar. Does that make sense?
Yes, thank you very much, Jesse.
No problem. And then, there's a number of ways, again, we can do that. Whether you want to include the consent form in there as well, the attestation form, because I know there's a lot of documentation that's being recorded in these clinics. And one of the conversations that needs to be considered is, are we filling out those forms in the EMR, or is our priority simply just to have it recorded and in the patient's chart? Now, the difference is, if I'm just filling it out by paper and pencil and giving it to my healthcare provider to upload into my chart, it's really just a picture that we can't get any data or metrics from. So it's just as good, again, as a picture that we can't necessarily run a report on, other than the fact that it was put in the EMR. So if our only metrics that we're looking to gather from these consent forms and these attestation forms is just the mere fact that they have a physical copy in their chart, and we just want to know the number of people that have a consent form, that's fine. Uploading might be the better option. Whereas if we're physically going in here and looking up the consent form for our COVID vaccination and filling it out in the EMR, we're able to generate a little bit more detail in terms of tracking information. So we can track any of these fields here. We can track what kind of consent was given. We can track which vaccination was given. And you know what I mean? Like, all of these fields here have some sort of reporting purpose in the system that we can generate information from. Picture, we don't have the ability to necessarily dive into what these actual fields on the form say. So that's a conversation that needs to be considered. So if there's a picture or a custom form, either one of those can be faxed to another primary care provider, like Elaine was describing. Maybe you want to put the consent form, the attestation, and the actual recording of the immunization, like I have here, sent all in one kind of complete package. That's a possibility. Whether it's a custom form like you see here, or just a picture of the paper form, you can do either way. But we just need to consider what kind of metrics are we looking to take out, if any, with regards to the consent form and the attestation. At the very least, though, in terms of like tracking the information and recording that a patient has received a COVID-19 vaccination, the very least it needs to be put in the CPP section here using Control J to record it. Otherwise, it really becomes difficult to manage your client list and say, well, did they receive it? Did they not receive it? Do we have to like scroll through everybody's chart to get a list? You know what I mean? It can become very difficult to track information if we don't have a clear defined system and how we're putting that information in. So I want to make that clear with everybody. And there's just a number of different ways that we can work around that tracking piece. It really depends on what we anticipate we need to extract later. So some of the tools that we've been working on, aside from actually putting those consent forms in the EMR, now we do have a number of the ISC and the Ministry of Health consent forms in everybody's EMR right now. So I mean, if you do decide to eventually do that method, those tools should be available to you. Sorry, I'm just checking the chat here. From Dylan says, we're utilizing a system that has been provided to us by the health unit to collect this information. It's called COVAX. Right, there is a COVAX system that a lot of clinics are actually using, and that's great to hear. So consents will be done verbally to patients, but we're also giving them the option to fill out the hard copy forms. Perfect. So yeah, there's definitely a number of different ways we can go about this thing, especially with the COVAX system. Now I know a lot of the island and some of the North Shore clinics may not necessarily be hooked up with the COVAX system quite yet. And to be completely honest, I've not been given the opportunity to necessarily dive too deep with that information or what the COVAX system really looks like at this point. So any information you have, Dylan, is greatly appreciated. But yeah, just keep in mind, there might be different workflows based on what your requirements are with COVAX, with PS Suites, with your chief and council, with your government directives. There's a lot of things to consider right now, and everything's kind of coming down the line very, very quickly, as everybody knows. So I mean, if all you really need is a verbal consent and an uploaded copy of that consent form, that's fine. We can totally accommodate that in the EMR, you know, upload it into the patient's chart and at least have that in there. As a matter of fact, that's actually a good segue to move into the managing received documents. So for example, if we do actually have a consent form that we want to put in there, what we do is we'd open a patient's chart, go to manage received documents here. And this is asking me, well, where are you hosting that information? Where do you have the consent form? So I'm just going to say it's in my desktop. And it's going to pull up a window here where I'm going to be able to specify which form I want to put in there. I don't know if I have any PDFs or not. But I would select my document that I'm wanting to bring over into the patient's chart. And at the very top here, I specify whose chart that's going into. And I want to file that as a report. Now, additional information or additional fields are going to show up here. And the ones that you need to fill out for this to work are the red asterisk ones here. Date created, report category. So for date created, we can say today. And report category, I believe I set some COVID.
I'm doing these here. Waiting for the list to come in. As soon as it comes in, I can check them all.
No.
Okay. Yeah, so I'll do that and see. Okay. Good. Yeah, so I'm gonna.
So we have a list of different categories here. I'm going to mute whoever's talking in the back there.
Okay,
Thank you. So we can have actual categories that say COVID in the EMR so that we can drag it over here just to at least define that this is a COVID consent form. So let me just see if there's an actual consent from patient. We can use that to indicate it. And then we save that into the patient's chart. Did I do PSS baby or PSS boy? I did PSS boy. Right here. So there's our consent form. Oh, where'd it go? And then there's a paperclip on here to indicate what that form looks like. And it's going to open up Microsoft. So I'm just going to skip that. But at least that picture of the form is going to be in the chart somewhere, and it's going to be in that little paperclip. So if we have some sort of reporting criteria or category that says consent from patient, or even going even further and labeling it as a COVID consent form or category, and this can be done by any administrator in your EMR. So as long as you have administrator privileges, you can go into settings, preferences here, and look for report categorization, category management. And I'm just going to look up COVID-19. So then that's going to give me a subcategory of consent from patient that's a little bit more specific to what I'm putting in there. So if I save those changes, go back into the patient chart, do the same process for manage received documents again, click on my document. Again, I don't think I actually have a consent form in here. But if we go to PSS boy, report, now under my report category, I should have an option here for consent. Oh, you know what? I think I need to log out and back in for those effects to take place. Sorry about that, guys. Let me just give me a second. Bear with me. Consent. There it is, COVID-19 consent from patient. So now we can use that to be the title of the consent forms we want to put in there, for example. And then after the fact, we can build a search even that looks through every chart and says, I'm looking for specifically forms or any kind of chart that has the wording COVID-19 consent form in it, for example, or consent from patient rather. And that gives us a very easy way to be able to extract at least a list of people who have that consent form in their chart, if that makes sense. I hope that was clear for everybody. I know I kind of went in a little bit of a zigzag to get to a full circle, but again, there's a consent from patient piece here. If you click on this magnifying glass here, you could type in consent. And what that does is it gets rid of everything in the EMR that doesn't have the word consent in it. Okay, what else we got here? So we're good with Control J, we're good with searches, reminders. So we want to kind of be able to isolate or at least remind ourselves as a provider, well, you know, when did this patient get their vaccine? Do they have their first one, their second one? Like, how do I know? And so if you look at our reminder section here, what I've done is I've created a list of or a number of different reminders that we can use to be able to know who has the first dose, the second dose, who hasn't been vaccinated. And that's all set up. If you go to settings here and edit reminders, very similar to how you set up a search is how you set up a reminder system. So for example, COVID-19 reminder, no dose. This is looking for anybody in the EMR that does not have the word COVID in their immunization CPP section here, because that means nobody's entered any information that they've gotten COVID. So then, you know, that we can assume that they don't have their shot yet. And what that's going to do is it's going to flag an intervention in their reminder section that says no COVID-19 vaccination recorded. So as a counterpoint, I've got one set up here for COVID-19 reminder. They've gotten their dose 1 of 2. Now this is looking for any patient in here that does contain the word COVID in their immunization section and has text that says dose 1 of 2, whatever language we decided to use in that comment section. Again, that's where I strongly urge to have a standard language when you're inputting those comments when you do the immunizations. But this is looking for any patient that has dose 1 of 2 greater than 1 time and dose 2 of 2 less than 1 time. So if they've only got 1 shot in the EMR, or they've only got their 1 Pfizer shot or their 1 Moderna shot, it's going to flag as a new reminder here. And I think I've got a number of patients in here that I did go ahead and include 1 shot. So Jesse PSS, for example, has 1 recorded shot, dose 1 of 2 left arm, and it says needs dose 2 of COVID-19 vaccine. So we can set up these different reminders to keep us up to date on where their vaccination history is, but this can go outside of just COVID vaccination for any kind of follow-up treatment or any kind of administration you need to do with a patient, procedures or anything like that. So just keep in mind that's where this is taking place, is under edit reminders. And if we want to make a new reminder, we just need to click new reminder, add line, and then from that list of criteria, we can define what the parameters are for our reminder and how it's going to intervene in the patient's chart. Are there any questions with the reminder piece? I know that can be a little bit confusing for some. Perfect. Now, one of the alternative things that we've been considering internally here with GHL is the potential utilization of a dashboard using our dashboard to track who's received the COVID vaccine, who hasn't received the COVID vaccine, and things like this. And so what we've created is essentially a consultation form, similar to what your internal referrals look like, just for COVID though. So in this sandbox, we've got this COVID tracker, consultation request COVID tracker. If I drop that into a patient's chart, what it's giving me is essentially a list of options here for the manufacturer. Okay. The priority, whether it's low, medium, or high. Status, and this is the big one here, is the status. Has dose 1 been booked? Has it been administered? Has dose 2 been booked? Has it been given? And you can update this form on a regular basis based on where the patient is in that cycle. So dose 1 of 2 booked. And then appointment status. We'll say needs dose 1. So if I drop this form into the patient's chart, what that allows me to do is create a dashboard here to keep up to date with the information on that dashboard. It's going to take a few minutes for this to update, but just to give you an idea that if we use that consultation form, we're able to create a dashboard in here that we can sign in and say, okay, dose 1 of 2 booked. And it'll give us a list of all of our patients that require that follow-up and complete. How many of our patients have actually gone through the whole thing, got dose 1, got dose 2, and they're done. And then again, how many people have not even gotten the vaccine yet? So things like that we can utilize this dashboard for, if that's something that we're willing to do. Now that, again, that requires the input process to have this form in every single patient's chart to keep up with that. And that might be incorporated to the workflow within the clinic as they're being administered. It's just something that we thought may be beneficial for clinics. And if it's something that we want to adopt, we can definitely look into adding this to everybody's EMR. But again, this is just a draft that we're really hoping to get some feedback on. So with that given, I think what I'd like to do for the next 13 minutes or so is open it up to a Q&A and really get your input on what troubles you're finding, what you're anticipating may be a potential issue with regards to tracking this information. And again, everything's kind of hectic and up in the air and super fast right now. So if you guys have any questions for me with certain workflows or certain areas in the EMR you think deserve more attention, let's use this as an opportunity to address some of that. And if you have anything, unmute yourself and fire away.
I just have a question. I think mostly for Dylan. I'm just curious with that COVAX system. Will that all that data, will that be available for you at your fingertips after after the immunizations are done? I'm just trying to understand like that versus putting the info in the EMR, like how that works after the fact in terms of accessing the data.
Yeah, so as a super user, I believe that there's a way you could do the data dump into your EMR.
Oh, really?
That was one of the questions I had, because I was thinking that it would duplicate the work and duplicate the amount of work that we were doing. So
for sure. Yeah, because you might end up having to enter it twice potentially if you wanted it in the EMR.
Right.
Definitely be curious to see how that data dump looks, because I know it can often be tricky to dump information like that into the EMR. Thanks, Dylan.
Yeah, no worries. I'll try and share as much information as I can with some of that the COVAX system.
Perfect. Yeah, appreciate it.
Absolutely. Thanks,
No
Dylan.
problem.
It's one of the things we can consider using those searches for too, is once our clinics has been done and we've actually inputted that they've received their COVID-19 vaccine, we can create a search to isolate a list of people who've actually received it. So for example, if I add a line here and I set my parameters to look for COVID in everybody's immunization section and press test search, that will spit out an entire list of patients that have received at least one of 2 COVID-19 shots. And if they have received 2, we can see that they've received 1 here and 1 here, and it'll give us a date of when they received those.
That makes me think of Elaine's question there about sending the record over to, like, say, the family health team. I'm wondering if, so Jesse gave the example of how we can digitally fax it, which is a good solution for sure. I'm wondering if it also could be suffice to generate the report. So say all of the patients from, so say you wanted the Northeastern Manitoba Family Health Team, so like all the patients from Shagawinda and AOK, generate a report as you just have, Jesse, and just filter out the ones from those communities and maybe provide that to the family health team. So then it could be up to them if they want to input it in that EMR or not, but at least it's you know, a report instead of firing it off one by one.
Mm-hmm. So then again, we're just adding a couple of extra columns or parameters that say we're looking for a specific city address, or we're looking for a specific primary location that we record that information in, things like this.
Or postal code.
Postal code potentially, however you want to dive deeper into your demographic of patients.
Excuse me, Jesse.
Yeah.
During immunizations, besides putting it into PS suites, we need to have a report at the end of the year about what we've done, how many have been done, and specifically communities. So how many children in Shishigwanin versus how many people in AOK. And the doctor, we usually let them know, like, so that is on a one-to-one basis. I know COVID, we're doing groups, many people, but that's already being done. If I immunize your child, then it gets to your doctor. They're aware of it. Yes, I haven't done it but through PS Suite or anything. I don't have access to the EMR at the family health team, but I do fax information like that. Here's your, you know, Dr. So-and-so, your patient, blah, 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 was seen and has had this done. So whether or not they put it in their chart, that's their problem. I'm giving you the information. Yeah.
Right. So there's a number of different ways you can do that too, Elaine. We mentioned the faxing piece there. But what you could do if you're looking at a bulk list of names, like if we're looking at very limited information from each patient, you could set up one of those searches to look at all of the patients that have been vaccinated, and then you can, you know, organize that information in an Excel spreadsheet and send that in bulk to the provider. Does that make sense? So instead of faxing one by one, you can organize an entire list and then give it to the provider that is appropriate.
Yeah, thank you.
Yep.
The one thing I might add, just in terms of the faxing, the nice thing is if you're faxing it to a doctor or provider that also has PS Suite. So for example, the family health team, all the doctors there use PS Suite. When you digitally fax that, it doesn't necessarily just come in as a fax, since both parties are on PS Suite and have functionality called Med Dialogue turned on. Basically, the receiving provider, or whether it's the receptionist or whomever receives that, can actually just click a few buttons on the receiving end, and that actually just automatically goes into that patient's chart in that EMR. It's not so much a manual process that they get like a paper fax and then they have to scan it into the chart. It's really, since we have Med Dialogue turned on now at the family health teams and with the First Nation health centers, it makes that digitally faxing process a lot less clicks, a lot less steps, and for it to work its way into both of the charts, not just the one chart.
So were there any concerns or questions from anybody else? I know Kelly's in here, and Val and Leah, Janice, nice to see you. Are there any concerns that maybe you guys have experienced with your first wave of vaccination clinics? I know Chaging's had one last week. Any issues you guys are running into or concerns coming up that you're wanting to get more information on? I know I've signed myself up to help with the inputting piece next Friday with your new clinic. But I mean, are there any questions or planning pieces that you might want to bring up?
Hi, it's Kelly Jackson. Not yet. It's kind of, we have to roll with when we get things. So we are not on the list for COVAX yet to get that software. I was making some frantic calls on Monday trying to hopefully get that set up for us for the clinic that happened yesterday, but we have to get approval to have our name on a list before that happens. So that's fine. I'm not exactly sure what the team was doing or what system they were in when they were inputting information, so I'll find that out later. And yeah, we'll kind of figure it out as it goes. I know there was some questions about First Nations information, basically in OCAP agreements, and that being the COVAX software kind of being in conflict with that. But it was just a very brief conversation that I had with the primary care manager yesterday. So we're hopefully going to touch base later in the week to figure out what data we have, how it's going in, whose system, that kind of thing, because we did collaborate quite a bit yesterday. And it seems like that'll be the case going forward. And to me, that makes the most sense for what we're actually doing, not the most sense for our PSS, but for the people and like the staff involved in all of that, it makes sense how we kind of collaborated and approached that. So I'm not sure who will get that data or how that'll be split up, but we'll worry about that later. So yeah, my point is I don't have any questions at this point. I may once things start rolling, but right now just kind of waiting and seeing. Thanks.
Absolutely. Yeah. Thanks for that, Kelly. And a lot of people are probably in the same boat of we don't necessarily have a system in place. We just know, this is go, and we're just making the best of what we have, and then we'll go in after the fact to kind of clean it up. Totally understandable. And I mean, GHL is always there to help anybody, strategize moving forward, or fix what may need adapting after the fact once the information has already been recorded on paper. If you want to have different PSS strategies, we're always there to offer that help there. And as a matter of fact, I'm going to put my information on the board here in case anybody doesn't have it. Oops.
Hi, Jesse. Kelly, it's Janice speaking. We are running our first clinic out of the IFC Center on Thursday. We do have access to the COVAX application. So Kelly, I can maybe touch base with you because this is first for me too. So we'll see how the day goes, any glitches that we come across, and I'd be happy to share that with you, Kelly.
Sure. So are you set up with the COVAX software yet? Or do you have?
Yes, we are.
Oh, okay.
And I'm the one that's actually going to be entering information into the COVAX system. So I'll know a little bit more after we go through our first run. So yeah, Thursday's our very first clinic. So I should have more information I can share with you after that for sure.
Okay, great. That sounds good. I think at this point, the biggest hurdle is getting our name on that AO list and then kind of having discussions about which client information is going in because they're, we were doing off reserve and on reserve. So some of those clients do not want their information shared, and I don't know all the pieces yet, but yeah, that'll be a rich discussion. So thanks for sharing that once you get there.
Yeah, for sure, because we're doing on reserve and off reserve as well. So yeah, it'll be, I'll like I said, I'll have some more information once we get through the first run and see how things go. I'd be happy to share too.
Okay, thank you for that, Janice. It's Mike here. I just want to thank the team and everyone on the call here for joining in. It's I know that as Jesse's mentioned a few times over this webinar, it has been pretty fast and very dynamic in terms of the whole vaccination process, especially when it's come down to the actual clinics taking place. So GHL has done our utmost to try and be supportive in our role to support the digital health systems and requirements that you may have in your own respective clinic. So of course, as you know, for this particular webinar, it has been recorded. We'll make sure to post it so that if there's others that you may be aware of that wanted to attend but got called away for whatever reason, that will be available. We've also been asked to participate to support some of the vaccination clinics for some of our First Nation members. And so we've been doing our utmost also there to be available and support these vaccination clinic processes as they occur. And I just want you to keep in mind too that if there's any other supports that you feel that you would require from GHL at this time, definitely drop us a line, put a request in. I know Jesse's going to be sharing or is sharing his contact info. And so what we're trying to do is be as available as we possibly can be. It'll be either Jesse or other members of our team to follow up and support the vaccinations of your population. So again, I just want to thank you for being on this call, and definitely keep us in mind if there's any other support requirements that you think that GHL could play a role in. The other thing, like one of the big ones has been even something as simple of, as connectivity to ensure that the systems are fully connected to the internet where the vaccination clinics are occurring. So that's one of the roles that we have played already. So definitely keep us in mind. We want to see you make this whole vaccination clinic process as smooth as possible. So again, thank you. Jesse, I'll turn it back over to you.
Yeah, no, thanks, Mike. And with that being said, again, I'm going to reiterate what Mike said: is reach out if you guys have any questions at any time. We're going to make ourselves very flexible, even beyond our work hours, to try to accommodate the clinics that are going on right now. So I'll leave it at that. And I thank everybody for taking an hour out of their day during this hectic week to come in and listen to some of the recommendations and tool tips that we have for you guys. If you want any more follow-up and some of these areas, and even added to your EMR, I know there's some of these tools that we don't necessarily have in every EMR yet. We just wanted to get some feedback. But if there's some things that you want done right now, get in contact with me. Again, reach out via email and phone, and we'll make things happen. So again, thanks very much, everybody, and safe travels and safe wishes to you and your family during this pandemic.
Thanks so much, Jesse, and
Thanks,
everyone
Jesse.
else at GHL. Take care.
All right, thanks, guys.
Thanks, Jesse.
Thank you.